I'm Dr. Bharat Shah. I'm a board-certified plastic surgeon. I've been in practice for about 20 years, and throughout that time, I've practiced hair transplant surgery as well. I've been very happy to build the practice to be a surgical and non-surgical practice. Plastic surgery is well known around the world, but now non-invasive procedures are more and more important than ever. So depending on the patient's needs, we may package the therapy, PRP, laser therapy, microneedling, whatever it takes to get that scalp stimulated and to get the hair growing. So what we're using the low-level laser therapy in our transplant patients is to treat the donor site to reduce shock loss at the donor site. We use it because it's been shown that low-level laser therapy also helps with wound healing at the donor sites. We use it at the recipient sites where we place the grafts because we want to get those grafts to grow, but again, we don't want shock loss if there's already hair there. We don't want someone to get thin before they get thick. You know, one thing that's interesting about laser therapy is when it first came out, it was this giant machine that you had to come into the doctor's office, looked like a giant hair dryer. And they were really expensive. And they were expensive for patients. They were expensive for the doctor to maintain. Then it became something they could take home, but didn't really use. And now it's something that they can use every other day, and I see the benefits. We've been using low-level laser therapy in our practice for about 5 years. And we started out using the laser comb type device, but a lot of patients wouldn't use it. It was difficult to use, it was cumbersome. They would buy it, they'd use it for a few weeks, and then they never use it again. So we looked for another way to get patients to get good laser therapy, and what we found is, when I first saw a laser design in a cap, it was a great idea. It wasn't yet FDA cleared. So we waited until the first company became FDA cleared, with clinical trials, with data, and proof that it was safe and effective. And that's when we decided to go with the Capillus brand. So we see that laser therapy is beneficial for most of my patients that have hair loss. I mainly see patients with androgenetic alopecia, both men and women. A typical patient will be a young man who's in his 20s, that's rapidly losing hair, is very distraught about it. He's too young for a hair transplant. So we need to do something to stabilize the hair that he has and make him a candidate for transplant. Another potential patient will be a female who's losing hair. They're very distressed by it, and we may have a combination of therapies for them, but it always includes laser therapy. So when people ask about how to use the device, I can tell them because I use it myself. I think it's important. I think it's important for me to be able to share my experience with patients. So I want to make this as easy as possible for my patients. We want to use the device 30 minutes every other day. And the device is great because you can't tell that someone's having treatment when they're doing it. But most patients are using it in the morning. They get up in the morning, make a cup of coffee, check their emails, and by the end of that, they've already had their treatment. So another thing I like about Capillus is that they have 3 different clinical strengths of devices. That means we have the professional strength that we can offer patients, but there's a wide range depending on their budget. So there's something for everyone. So from what I've seen and what I hope going forward, that Capillus has the best technology. I want to have the best technology for my patients. So I'm hoping that as technology gets better, we get it out faster, but we still do it safely. That's the key.